Suicide is the 10th leading cause of death among adults in the United States. And for veterans, it's a particularly large problem. We know that 20 veterans die each day by suicide. And in the past decade, the total number of deaths among veterans from suicide is more than the total of deaths during the Vietnam War. It's widely acknowledged that we need a public health approach to address the challenge of suicide. We need comprehensive approaches that really identify and address 6 priorities. 1, that we promote the use of self-care skills. 2, that we identify those at risk. 3, that we enhance our crisis intervention and response capabilities. 4, that we provide high-quality mental health care to those in need. 5, that we provide an appropriate response when a suicide does occur. And 6, that we restrict access to lethal means, the means by which people choose to die by suicide. To address the problem of suicide among the veteran population, I recommend that we implement and enforce a zero-tolerance policy against sexual harassment and assault within the military and veteran community. We know that military sexual trauma is a known risk factor for suicide, and we must decrease exposure to this culture while people are in uniform and when they visit the VA. Second, we need to address work-related stress. There are a large number of veterans who are in the federal workforce, and we know that work-related stress can lead to poor sleep and use of alcohol and drugs, which are also risk factors for suicide. Third, we need to expand and improve the U.S. healthcare system. We need to ensure that we have enough mental health professionals, and we need to ensure that they are delivering evidence-based approaches for mental health problems. Treatment can work if providers deliver the right course. We need to ensure that parity is fully implemented and enforced to ensure that we are providing that workforce with the skills and capabilities that they need to attend to the population's needs. And finally, we need to restrict access to firearms among veterans who are at risk for suicide. 70% of veterans die by a firearm, and we need to ensure that we restrict access to these lethal means among those who are at highest risk.